Good morning and welcome to our live session from SL Raheja Hospital. We are thrilled to have with us today our esteemed consultant orthopedic surgeon, Dr. Dhrumin Sangoi, who will be sharing valuable insights on diabetic foot disease. Thank you for joining us, sir.
Thank you.
So, I would like to introduce Dr. Dhrumin Sangoi. He is a distinguished consultant orthopedic surgeon specializing in foot and ankle surgery with over 18 years of extensive experience. He holds prestigious credentials including MRCS and FRCS degrees from the Royal College of Surgeons of Edinburgh. In underlying his commitment to excellence in the field, Dr. Sangoi honed his expertise during a fellowship in foot and ankle reconstruction at the world renowned Royal National Orthopaedic Hospital in Stamford, London, where he developed a deep understanding of complex foot and ankle conditions. His patient centric approach to orthopedic care is complemented by his dedication to achieving optimal outcomes in the intricate realm of ऑर्थोपेडिक सर्जरी सो मैं आपको कुछ बताऊंगी कि उनकी स्पेशलिटी क्या है सो ही स्पेशलाइजेस इन फुट एंड एंकल डिफॉर्मिटी foot and ankle fractures, sports injuries of foot and ankle arthroscopy, ankle replacement, minimally invasive foot and ankle surgery, and diabetic and Charcot foot. So, welcome, sir, and we'll have some questions for you. So, it would be great if you can please answer all of it. Thank you.
Yes, my pleasure.
So, thank you, sir. So, should I start with the questions?
Yes, we can go ahead.
Okay, thank you, sir. So, the first question for the viewers is what is diabetic foot disease and what is Charcot foot?
Okay. So, foot is one of the part of the human body where diabetes plays its role, and people with high sugars and diabetes they have problems in the foot. So we all know that India is leading in diabetes population, and around 11% of the Indian population, which is more than 100 million people, have affection with diabetes. And whenever the sugars are high, even in the tissues of the foot and ankle, the sugar levels are high. So any injury can cause delayed healing or ulceration, which is a defect in the skin, and that takes a long time to heal. So this is basically called a diabetic foot disease, where
Okay.
you get an injury because of diabetes, an ulcer develops, and then it takes a long time to heal. Sometimes you can get infection in the foot, which we call as cellulitis. That is more common in people with diabetes. The reason being the sugars are high in the blood and in the tissues around, like the muscles and the fat, and that is the reason that the bacteria can thrive there and cause infection. So this is basically diabetic foot disease, and Charcot foot is also a part which is seen in diabetes. Now this is more commonly seen in people who have diabetic neuropathy, and neuropathy means the nerves which supply the foot they get damaged. So the talking between the brain and the foot is disturbed because all the information from the brain goes via the nerves to the foot. And when you get neuropathy, which happens in people who have long-standing diabetes more than 10 to 12 years, the nerves get destroyed, and hence you can develop a Charcot foot. And what happens in that is the bones in the foot they become weak, they become disintegrated. You can get fractures in the foot without any pain. So people will not notice that they've got any pain and they'll go to the doctor, but they'll start seeing their foot is swelling, their foot changes shape, and the sensations become less. So this is basically a Charcot foot developing in the diabetic population.
ओके ओके थैंक यू सो मच सर आजकल हॉस्पिटल में बहुत सारे केसेस आते हैं वेयर दे हैव डायबिटिक फुट डिजीजेस लाइक इट्स इंक्रीजिंग अलॉट इन इंडिया thank you so much for answering that. The next question for you, sir, is that what are the signs and symptoms that we should be looking out for?
Correct. So, before looking at the signs and symptoms, a small thing on precaution. So, each patient with diabetes should be precautionary to check their feet regularly. आपके feet को हमेशा check करना है ताकि sensations बराबर है आपके. Number two, there are no skin ulcers or breaks in the skin. कुछ भी injury हुआ या damage हुआ that can lead to an ulcer जो काफी time लगता है heal होने को. Third, keep your feet dry. Whenever you have a bath or a shower, make sure your feet are dry. There is no moisture specifically in between the toes. And number four, regular checkup with your diabetologist about your blood sugars being maintained and about the health of the feet. So
Okay.
that is a precaution. Now, when you develop a Charcot foot, what are the signs and symptoms? So number one, you will see there is swelling in the foot. So it will not be on the other foot, but जिस foot में Charcot develop हो रहा है उधर swelling या सूजन हो जाएगा. There will be a
Okay.
bit of redness in acute cases. यानी अभी Charcot foot start हुआ है तो redness आता है. कभी-कभी temperature increases in the foot. If you feel the temperature of the foot and the rest of the body, you will feel के ज़्यादा गर्म है foot का part.
Mhm.
So these are the symptoms which general people will see. And if they see that, and if the patient is a diabetic, then you should not take it lightly and see a diabetologist or a foot and ankle specialist to get it evaluated. And the signs which we see, so sometimes these are the symptoms which you feel, and the signs are sometimes like ulcers. You can get ulcers in the feet. Then
Mhm.
sometimes you get deformities, foot changes shape, and normally we stand like this. We all have an arch. So in
Yes.
Charcot foot, the arch collapses, and you get a reversal, which is called as a rocker bottom foot. So rocker bottom foot is a characteristic where your arch gets reversed and it becomes flatter. So these are the signs and symptoms, and once you develop that, you should see a specialist.
Okay. Thank you so much, sir. So please बताइए कि how do you diagnose the Charcot food, and what are the investigations that needs to be done?
Correct. So whenever a patient comes with these symptoms, which I just mentioned, we keep a high suspicion of Charcot foot in all diabetic population.
Okay.
So apart from seeing these symptoms and signs which I just mentioned, we have certain tools like we have small uh, needles or pressure gauges which we apply on the skin to check if the patient is feeling that or not. If the patient is not able to feel that, that means he has a neuropathy. यानी nerves या पाँव की नस काम नहीं कर रही है, तो sensations नहीं है. So we check that. We check the blood supply by something called as a handheld Doppler, which is available in our clinics in the OPD. कि blood supply पहुंच रहा है foot में नहीं. So that is by Doppler examination. Then we check the temperature. Again, for that we have an instrument where we check the temperature difference in the two foot. And अगर वो 2 डिग्री से ज़्यादा है, there is high risk of getting Charcot foot in that particular foot. The fourth thing is pressure. We have vibration sensors, and we have instruments to check that whether the vibration sense of the patient is affected or not. So these are different instruments which we keep in our clinic where we can check whether the patient is developing a Charcot foot or not. And
Mhm.
once we do this and we have a high suspicion, then we do some imaging, which is X-rays. So X-rays may we see the bones, where the bones get fractured or break or they become crumbled and disintegrated. That all we can see in the X-rays. And sometimes in very early cases, the X-rays can be normal. So in that cases, we have to go to higher investigations like a CT scan or an MRI. So these are the new tools and advanced investigations which helps us to pick up the earlier cases. So basically, these are all the science tests and the investigations which we rely upon. Also, the blood supply we have to check. So sometimes if on Doppler we see that the blood supply is not good, then we go on to higher investigation like an arterial Doppler or an angiography to see the blood supply. Because again, diabetic population, their blood vessels, they get narrow over time. उसमें अथीरोस्क्लेरोसिस और प्लाक्स बन जाते हैं ताकि ब्लड सप्लाई कम हो जाता है. So that can be checked by those tests.
Okay, okay. Thank you so much, sir. Much appreciated. Sir, एक बार develop हो गया है Charcot foot. So, what can we do to avoid it getting worsened?
Yes, so as I said, we need any patient who is a diabetic and who is having problems in the feet with swelling should see a diabetologist or their doctor or a orthopedic surgeon or a foot and ankle specialist as soon as possible. Once they get to us and we suspect, we run all the investigations, and once we get that, we have to manage it. Okay, So the initial phase to prevent going it further and deeper into proper Charcot, once we suspect a Charcot foot developing, we have something called as total contact cast. So total contact cast is a plaster which we apply in the foot from the toes to below the knee, which helps in reducing the swelling. So it will help in reducing the swelling and it will keep the bones in place. And also we ask the patients to offload their foot. Offloading means पाँव पे वजन नहीं रखना है. You should not put pressure on the feet for a couple of weeks and we monitor them till the swelling reduces and we monitor them with serial x-rays. So those are the things which we do initially apart from the investigations and we start the treatment. And the another important part is controlling blood sugars. When we are doing all this, we don't have to keep the blood sugars high to 300, 400. We have to manage that as well. So we have to take help of our diabetologists and control the blood sugar. So everything works together to get your problem under control.
Okay, sir. Thank you so much. Sir, the last question is, how do you treat and manage Charcot foot?
Yeah, so the initial part I just mentioned, as in whenever a patient comes in, we detect that this is a Charcot foot problem and we do all the investigation test, and this is the initial part. So most patients are detected early, and with this plasters and blood sugar control and offloading, as that is not putting weight, they get managed. However, we are in India, not everywhere healthcare is available as easily as in cities like Mumbai, Delhi, etc. And we get patients in the later stage. Now, later stage, when they come, the patients have already had this problem since like 1 year or 2 years, and then they come with deformities. That is, the foot becomes deformed, the shape of the foot changes. The swelling period has all gone 1 year back. Now the foot has changed the shape. There are ulcers in the skin. So most of the patients get ulcer on the sole of the feet because the arch collapses and the pressure point is down. So that's where they get the ulcers. So then we have to manage them differently. We have to again check their sugars and reduce the swelling with plasters. And if the X-rays and MRI shows that the bone destruction is very high, then many of these patients need surgeries to correct the bony deformity and to make the foot stable. The Charcot foot, the bones, they disintegrate, dissolve, and the bones become unstable. So we have to stabilize them with rods or plates and screws. And along with that, we have to manage the skin with ulcer debridement and regular dressings. So these are the final stages where late patients come to us, and that's how we manage them. Once we do the Charcot foot surgery, there is a rehabilitation period of around 3 to 6 months. So the patients need to understand that just doing a surgery doesn't mean that they are back on their feet and running about the next day. It involves a period of rehabilitation because in diabetes and in Charcot, the healing response is little bit delayed as compared to young individuals like you and me. So in those patients, we have to protect the foot even after surgery for around 3 months till the bones heal and unite. And once that is done, then they can start walking and getting back to their normal life. So they will all go through a phase of plaster, then they will have a walker boot, they will be using a walker and a stick to walk, and gradually they will come off that and start walking normally. So that's the whole treatment process of Charcot foot. And the main aim of this is to prevent an amputation. Because if the patients come late and this all is not detected and the ulcer develops, there is infection, then amputation, which means cutting off the leg, becomes inevitable if the disease is not controlled in the early stages.
Yes, sir. Yes, sir. Thank you so much, sir. So, sir, would you like to please share with us a takeaway message for the viewers?
So for all the general population, beware of your eating habits. Even youngsters need to be taken care of their eating habits. Avoid junk food. Diabetes is gradually rising in India, and it will continue to rise. Seeing our daily habits, and all the diabetic people who are there and listening to this should keep a regular check of their feet. Any swelling, any injuries in the foot, see your doctor and specialist immediately and get it checked. and yeah, spread this message and video to as many people as possible so that they are aware, and we can help them as much as possible.
Okay, thank you so much, sir, for your time and the valuable information that you have shared with us today. I've got to learn a lot about it, and thank you so much, sir.
All right, thank you to you too. Thanks.